This is Join Us in France, episode 275. Bonjour, I'm Annie Sargent, and on a typical episode of Join Us in France, I talk with someone who's visited cool places in France and tells us all about it. But once or twice a month, I chat with my friend Elise, who is a licensed tour guide in France, and she loves the history and the art. And in this episode, it's just me talking to you about a question that comes up a lot in the Join Us in France close group on Facebook. For today's episode, I had planned something very fun, favorite shopping spots in Paris, but I'll save it for later because I know a lot of you have had to cancel your trips to France due to the Covid-19 pandemic. While this is sad and stressful, you're now dealing with getting your money back, and that's never pleasant. The pandemic will go away, and you'll have a chance to visit later. The uncertainty of the situation is driving everyone crazy. So I'll tell you where we stand right now in France, knowing full well that things will change a lot and quickly. I am recording this episode on March 13th, 2020, the day after French President Emmanuel Macron addressed the country and presented his plan to handle the crisis. So today I want to give you a summary of what he said and the measures being implemented in France. For some of those measures, we're not quite sure how they're going to work out in practice yet, but as a French person, I can take a guess of how it might be done, because it's probably going to be something like what we've done in the past. Show notes for this episode are on joinusinfrance.com/275, the number 275. And even if you can't visit France right now, you can still dream and plan your vacation on joinusinfrance.com. It's chock full of great resources. You should check it out. New review of my Saint-Germain-des-Prés voice map tour. If you're a fan of Join Us in France, and even if you're not, this tour is a must. Just like the Join Us in France podcast, this tour is well-researched, interesting, engaging, and fun. There are so many little details and tips along the way. You'll see shops and details that you probably would never find on your own. And best of, it's like spending a day with your own and ever-charming Mrs. Sargent. Thank you. Brava and merci, Madame Sargent. Thank you so much for that lovely review. You can check out the voice map audio tours that I produce on joinusinfrance.com/audio tours. So here's what French President Macron told us in his address last night. He said that the COVID-19 is the biggest health crisis France has seen in 100 years, and that people with chronic illness are at a higher risk. That's cancer patients, people with diabetes, and obese people. Yes, obesity is a chronic disease. He pointed out how medical professionals are doing a wonderful job in France so far, but we are at the start of this pandemic. The numbers will continue to grow at an exponential rate until we reach peak and it starts going down. We must remain optimistic and listen to doctors and scientists who study pandemics and suggest measures we know have a good chance of working. At first, this virus will sicken the most vulnerable populations, the elderly, requiring breathing assistance for many of them. We must continue to increase the number of hospital beds available for such patients while continuing to take care of those who have other urgent medical needs, obviously. There may be a second wave of disease hitting younger and healthier people later. We don't know if this is the type of virus that will die off in the summer or not, or if getting infected today gives us protection for future infections. We don't know those things just yet. We must let scientists look for the answers. The most important thing to know is how to protect populations at risk and medical professionals to slow this thing down. So, there were 13 action items. This is the first one. The president asked for those over 70 years of age, anyone suffering from a chronic condition, handicapped persons, to stay home as much as possible. They can still go out for fresh air and do grocery shopping as needed, but limit exposure as much as possible. This is where country folks like me have an advantage because I can take long walks without being in close proximity to anyone. I mean, I see people, I talk to them, but we don't have to touch. We still have lots of fairly small grocery stores in France. So, it's much easier than going to the giant Target, because it's a small store. It doesn't have that many people in it. It's going to be more challenging for city folks, but French cities have a lot of parks, open space. We still have mom and pop stores in cities. So, hopefully they will deal with it that way. We have municipal elections coming up on March 15th and March 22nd because we vote in 2 rounds in France. So this is action item number 2. These elections are still going on, but there will be sanitary measures put in place. Older voters will be given priority so they can be in and out as fast as possible. But mayors are in charge of holding all elections in France, whether it be for the president, for the mayor, or for anything else. So they will be in charge of establishing sanitary measures that will work for their local situation. There are over 800 voting stations in Paris alone. So obviously, the conditions vary from one to the other. In my village, voting is easy and fast. It never takes me more than 5 minutes. I suspect they'll ask people to use hand sanitizer when they arrive, maybe when they leave. No shaking hands with the candidates or the folks running the polling stations. Probably no standing around chatting. Some people like to do that. Yeah, not a good idea right now. Then Macron went into the reasons why it's so important to slow down the rate of spread of this virus, and it boils down to this. We don't want to overwhelm the hospitals. We need to have enough beds and respirators and trained personnel to run hospitals and never have to turn anybody who is seriously ill away. At the same time, we know there are going to be urgent medical needs not related to COVID-19, and those will need to be taken care of as well. Which led him to action item number 3. Childcare centers, schools, and universities will all close starting Monday and for an undetermined length of time of at least 2 weeks. My daughter is a computer science major in Toulouse at the university, and she mentioned that there were rumors. We've known about this for several days. But now it's official. The reason for this is that while kids are not showing signs of the disease when they catch it, it's like they don't even get sick, but they are still the ones who spread the virus around the most. They go everywhere, they touch everything. So many children and young people can have COVID-19 and show no symptoms. Keep that in mind, it's really important. Regional authorities and all elected officials will be in charge of making childcare available to anyone who works in the healthcare industry. Because obviously, if you're a nurse, like my neighbor, I'll talk about her later, she has kids. She needs somebody to take care of them. So in France, typically, it's grandparents. Like when school vacations are on, grandparents take the kids. But not everybody has grandparents or not grandparents nearby anyway. So there will be a free childcare solution for all of these people who work in healthcare. Kids will have access to an online curriculum. I'm not sure how well that's going to work, but that's the plan. At my daughter's university, they'll announce today, on Friday, what they're going to do about this, about continuing the curriculum and also exams and all that. Action item number 4, Macron asked all businesses to allow their employees to work remotely if they do the sort of work that can be done that way. More and more businesses do that anyway. He's asking that they double their efforts in that direction. Sounds good to me. Action item number 5. Public transportation will continue because stopping that would block the country, and we've seen the mess it creates when there are strikes. And it would prevent medical workers and patients to get to where they need to go. But the president invited French people to limit their trips to what is absolutely necessary. I've heard reports that the Toulouse metro was eerily empty this morning at rush hour on a Friday. I think that French people will comply because a metro or a crowded bus is a scary place during a pandemic. And so are airplanes and trains. Action item number 6. The government will announce more measures to limit gatherings. Now, last week they asked for organizers of indoor gatherings of over 1,000 people to cancel or reschedule, and they just lowered this to 100. So that will include theaters, movies, concerts, sporting events, all sorts of things. But restaurants and grocery stores will stay open. There's been no talk of closing them. No talk of closing hotels either. But hotels are emptying because people are choosing not to travel. So that's just how it works. Action item number 7. Hospitals must be ready to run at full capacity, and ICU capacity in particular must be ramped up. Medical professionals who retired recently may be asked to get back to work. Medical students will also be called upon to perform some tasks, like, for instance, it may be a medical student doing phone triage and answer questions from a worried population. Can you imagine the number of calls the emergency medical number must be getting right now? It's number 15, by the way, and I'm sure it's like completely full. So people are worried, many of them for no good reason, but you need to help people, talk to them, inform them, and assess them. And medical students are good for that. Action item number 8. And actually the president said, these are medical students who are about to graduate anyway, so he's not taking first-year medical students. Action item number 8, all elective medical procedures will be delayed and non-essential consultations will also be delayed. I'll mention a medical test I did this week in my personal update in a few minutes, and that could have been delayed, I'm sure, because it was just a preventative consult. They are doing this both to limit the number of trips people take and also to free up doctors so they can work in the hospital. Action item number 9, the French healthcare system will get all the funding it needs to buy equipment, train the workers, and pay salaries, obviously, no matter how expensive it gets. The president said this will give us a stronger health system in the end. Now, I want to remind you that in France, the healthcare system, the system is private. It's the insurance that is public. But we also have public hospitals, and they will get a lot of grants to ramp up quickly. Action item number 10, give researchers and laboratories the financial support they need to continue their research and come up with better and faster tests as well as treatments. They are also working on a vaccine, but it won't be ready for a long time, several months. Action item number 11, stand with those who struggle financially. We've had this thing in France called trêve hivernale for many decades. It means that you cannot evict a tenant during the winter months, even if they are not paying their bills. You cannot turn off their power or their gas or their water. This will be extended by 2 months this year. The compassion piece of this is important here. The government and all elected officials are asked to increase efforts to help the poor at this time of crisis, because as always, the poor will suffer more than the rich. Action item number 12. The economy is going to suffer as a result of this pandemic. We've already seen it in tourism, in the restaurant industry, the hotel industry, event organizers, the entertainment industry, the culture industry, etc. And that's a big chunk of the French economy. People are worried that their income might drop significantly from this, and they are probably right. Macron is pledging to support businesses and employees as well as independent workers. Folks who work for companies that reduce their hours will be able to collect partial unemployment. Instead of companies just laying off people, the government will take over paying salaries for a time. He mentioned that the Germans have a very good system to do this, and he'll seek advice from them, but no details at this time. French companies have taxes due in March, and they will be able to postpone payments with no paperwork and no penalties. Well, the French government getting rid of paperwork and complicated applications in exchange for tax relief is entirely new. But he said it'll be automatic, so there's hope. Action item number 13, the government is already working on ways to boost the economy once this crisis is over. France will continue to work with European partners and all world leaders because this is a global crisis and cooperation is vital. President Macron then called for individual discipline along with good order in the way that national institutions run. He reminded us that viruses know no borders and that we must unite our effort to support everyone in this time of crisis. He emphasized that nationalism is not the answer. Closing borders can be an effective measure at times, and Europeans may have to coordinate some border closures temporarily, but only when there's a clear need. But generally speaking, cooperation, he said, works better than individualism in case of a big health crisis. He admonished people to wash hands correctly, not to shake hands or embrace, and keep distances. He said it sounds silly and goes against our nature, but it really helps. We can all protect each other. By example, he said, write to your elderly family members or call them, but don't bring them the virus. Help your neighbors who work in healthcare if you can. He explained that he's counting on all of us to be generous and cautious at the same time. Now, I'll put a link in the show notes to his full speech, which lasted 27 minutes, translated into English if you'd like to hear it. I know some people will ask if France is on lockdown. No, it is not. I can come and go as I please. There are fewer events for me to attend. I'm asked to exercise caution, but nothing like a lockdown. There are no extra police in the streets. If anything, there will be less police because there are fewer people around. Why would you need so much police? Macron is implementing a government response that makes sense, in my opinion, and he's asking for a kind of self-quarantine. Not really a full quarantine, but self-imposed limitations. And, I'm okay with that. I haven't really heard anyone complain about it, to tell you the truth. And I would urge you to do the same. Don't travel for pleasure right now. Put it off. Not that the situation is scary in France. You probably have as much virus around where you live as we do here. But I think it's wise to stay put if you can. France will be here when the pandemic has passed. And panic definitely doesn't help. And I think some people are doing crazy things out of panic. It's human nature, but refrain. People on the group ask if I think it's going to be over by a certain date. And of course, they mean the date of their trip. And I really don't know, I'm afraid. They ask if things are going to get really bad in France. Well, I don't know either. We're trying to avoid getting to the really bad situation that some countries have found themselves in. I think we're well equipped. I think we have a smart president, but only time will tell. I'll continue to bring you a little bit of France every week. Next Sunday, it'll be an episode with someone who moved to France and had a baby here. So you'll get to hear about the French healthcare system from a different angle. And on the Join Us in France closed group on Facebook, I plan to keep it light as I can. I'm trying to keep politics out of it. It's very hard to do. So I'll talk about French cultural things, recipes, French movies, books, I'll keep answering questions if you have them. But I'd love for you to post your future plans or, things you did in the past that were lovely or whatever. But I really don't have a crystal ball, so don't ask me to predict. I can't do it. And one thing I can predict for sure is that it will pass. So be patient. I only have one real-life friend who she shared on Facebook that she thinks she and her husband have COVID-19. But it's a mild case, and they didn't get tested. In France, they're not testing everyone. They're testing a portion of the population. So they're staying home and writing it out, and, but that's one person out of thousands that I know. So if I didn't listen to the news and didn't read Facebook, I would have no idea that this pandemic is going on because it really has changed nothing around me. But that doesn't mean that we shouldn't be careful or anything like that. But maybe it means that we shouldn't panic, I hope you will stick around, keep listening to the podcast, dream about your next vacation in France, and I wish you a good health. And remember, the podcast bug is not dangerous at all. Thank you, Darlene Germano and Christelle Bergeron for Bergeron. Why am I saying it weird? For pledging to support the show on Patreon this week. Patrons enjoy several rewards that you'll find listed at patreon.com/join us, Patreos, join us, no spaces or dashes. I share exclusive content with my patrons, including help with your French comprehension, stories about France, photos, and membership into a secret Facebook group. And of course, patrons can message me directly through Patreon, and these messages always get top priority. I've been wondering if I should do a thing about Albert Camus' plague, La Peste. Maybe it's too soon. I don't know. We'll think about it. Visit patreon.com/join us to see the different reward tiers, and thank you so much for giving back. If you're not sure your itinerary for France is as good as it needs to be, let me review it for you. It'll cost you $50, but you get a full review. We go through the whole thing on the phone, and I send you my recommendations in writing. Email Annie@joinusinfrance.com to set that up and write itinerary review in the subject line. My thanks also to Amy Romanowski for sending in a one-time donation by using the green button on any page on joinusinfrance.com that says tip your guide. Amy said, "We leave tomorrow and I only found your podcast while searching for Learn French podcast 2 weeks ago. I've listened to several and they've been very helpful. Merci." Well, thank you so much. And of course, I'm also super proud of my voice map tours. Not only will you see the best of Paris, but you'll understand what you're looking at too. Woohoo! To learn more, go to joinusinfrance.com/audio tours. And if you'd like to support the show without spending a penny you wouldn't have otherwise, before you go shopping on Amazon or on booking.com for your bed, for your hotel rooms, go to the bottom of any page on joinusinfrance.com and click on the ads. Because you came to Amazon or Booking through my site, I get a small commission and it doesn't cost you a penny more. Imagine that. And thank you so much. For my personal update this week, well, life goes on quite unaffected for me. I already work from home. Spring is definitely coming, which to me means I get to spend more time in our small garden, which I love doing. I go to the store when I need something, but I saw this coming. And so I stored away many necessities just in case. So I've done all the big shopping and now I can just pop into the store for yogurt and fresh bread or something like that and go home. So I keep it quick. Last week, I even reorganized our freezer. I took everything out, put it in laundry baskets, wiped down the shelves and basket, and oh my goodness, the no frost freezers are so much better than the old things that used to, have big slabs of ice on the freezer walls. Anyway, I did that. I put everything back in its place. Now I know what's in there. And I've been in the habit of labeling and dating what I put in the freezer. So I am very proud to report that only one small item was a mystery item and that I threw it out. I still walk my dogs every day. The walks are getting a little longer as the weather is better. And I mentioned several episodes back that I had experienced some chest pains, and I realized quickly that they weren't heart-related, but since there's a strong history of heart disease in my immediate family, they wanted to check me out. So they hooked me up to a heart monitoring machine, once in the hospital the day after my chest pains, and once at home. And I went about my normal life. I had suction cups all over my chest and a tiny computer on my side that was recording everything. And that didn't show anything strange. The doctor said, it's reassuring. Okay, but he wanted more tests. So then this week, I did a gamma scan called scintigraphy. I'm not sure if you say it that way in English, gamma scan. They injected a radioactive product into my veins and took a bunch of pictures of my heart. And then they had me do a stress test. I was walking fast on a treadmill, on an incline. They injected more radioactive stuff and took more photos of the heart. It's pretty pictures, lots of data, but of course, none of that makes any sense to me. But the cardiologist said I passed and I'm good to go. So I'm really excited about that. When I showed up at this special unit that does nuclear radiology, the lady who checked me in recognized the name of my village, and she said, "Oh, we have a few people who live there who work in this area." And sure enough, one of the radiologists, a radiology nurse, I guess, lives just down my street, and I don't really know her, but she once gave me a letter that had been put in her mailbox by mistake. And her young son is a little skittish around the big dogs. So I talked to him about that because, I really want kids to be comfortable around dogs. I think that's a really useful life skill. Anyway, there she was, my neighbor, taking photos of my heart. And there was also a man who came by and said, "Oh, yes, I see you walking your dogs all the time." And they told the cardiologist that I have a walking habit. So when I got into the room to start the stress test, he said, "You're a walker, eh?" And I said, "Yes." And we talked about my dogs and we chatted until it was going so fast that I, couldn't keep up with the conversation. But a stress test doesn't last that long, maybe 5 minutes. 7 minutes. I don't know how long it was, but it wasn't that long. And at the end, he said something that really made me happy. "Keep walking your poodles. Your tests look great." And it even looks like you take a beta blocker and you don't. No, I don't. This was such a relief because, I've never been athletic, not compared to my brother and my sister anyway. They both run and they bike. My sister competes. She competes when she's not injured because that's the problem is when you push yourself really hard, you risk getting injured and then you can't do anything for a few weeks. That hasn't been a problem for me in years. I just walk, but I walk every day and I do it for an hour or more. And apparently that's a reasonable way to stay reasonably healthy. So if you're a sedentary person, let me remind you that becoming athletic is not really the goal. You can just walk. Go as fast as you can manage and work up to an hour or more. It will do you so much good. And I know we're all busy, but really there's nothing more important than your health. That's what we've been talking about this whole time, right? And I know that walking is not possible for everyone, but everyone can find something that they can do, I think. So that's really important. Taking time for yourself is so much more important than keeping up with the latest Netflix series or whatever. So I'm done preaching for today. Thank you for putting up with it. Now, it's a truth that lots of people don't think to look for a podcast to help them plan their trip to France, so tell them about it. They'll find Join Us in France anywhere they get their podcasts, including Spotify, Pandora, Apple Podcasts, and more. And if they don't listen to any podcasts yet, show them how it's done or send them to joinusinfrance.com. You can send questions or feedback to joinusinfrance.com. To Annie at joinusinfrance.com. Have a great week of trip planning, and I will talk to you next week. Au revoir. The Join Us in France travel podcast is written and produced by Annie Sargent and copyright 2020 by Addicted to France. It is released under a Creative Commons Attribution, Non-Commercial, No Derivatives license.